as the atherosclerosis. So, atherosclerosis is a specific type of arteriosclerosis. Atherosclerosis is also known as arteriosclerotic vascular disease or ASVD. So, this is the condition in which an artery wall is thickened as the result of a buildup of a fatty material such as the cholesterol. So, it is the thickening or hardening of the arteries. It is caused by a buildup of plaque in the inner lining of an artery. So plaque is made up of deposit of fatty substances, cholesterol, cellular waste products, calcium, and fibrin. So as it builds up in the artery walls become thickened and stiff. Next, affecting arterial blood vessels, a chronic inflammatory response in the walls of arteries. So, due to the accumulation of macrophage white blood cells and promoted by low-density lipoproteins without adequate removal of fats and cholesterol from the macrophages by functional high-density lipoproteins. Atherosclerosis is a slow progressive disease that may start as early as childhood, so however it can progress rapidly. And it is caused by the formation of multiple plaques within the arteries, so it can restrict blood flow. So these plaques can also burst, causing a blood clot. So atherosclerosis is often considered a heart problem. It can affect the arteries anywhere in our body, and it is preventable on treatable conditions. So atherosclerosis in addition can affect most of the arteries in the body, including the arteries in the heart, brain, arms and legs, pelvis and kidney. It has different names based on which arteries are affected. So as you can see, once the inner wall of an artery is damaged, blood cells and other substances may gather at the injury site and build up in the lining of the artery. So over time, fats, cholesterol, and other substances also collect on the inner walls of heart arteries. So this build-up is called plaque. So plaque can cause the arteries to narrow, blocking blood flow. Then the plaque can also burst or ruptured, that it can lead to blood clot. So this is the normal layers of artery. We have the intima, media, and adventitia. So this is the normal artery and disease artery. So the major targets of the atherosclerosis are the aorta, the coronary and cerebral arteries. So often produces critical ischemia of the intestines and lower extremities. So a major cause of abdominal aortic aneurysms.
Hello, I'm Amid Aikosain, and my assigned topic is the risk factors for atherosclerosis. There are many risk factors for atherosclerosis. Some risk factors can't be changed, and some risk factors may be able to reduce in some cases. These are the lists that include make a person more likely to develop atherosclerosis. Unhealthy blood cholesterol levels. This includes ILDL cholesterol, sometimes called bad cholesterol, and low HDL cholesterol, sometimes called good cholesterol. If you have a ILDL level or high low density lipoprotein, this means that you have too much LDL cholesterol on your blood. This extra LDL, along with other substances, form plaque. The plaque build up in your arteries. This will lead to develop atherosclerosis. The same with a low HDL count, because it is linked to an increased risk of heart disease. Let's move age. As the body ages, the risk of atherosclerosis increases due to a genetic or lifestyle factors which gradually build up a plaque in the arteries. By the middle age or older enough, plaque has built up to cause signs or symptoms in men. The risk increases after age 45, while in women, the risk increases after age of 55. Next is family history of early heart disease. So, Family history of early heart disease increases risk for atherosclerosis, but lifestyle changes and medication can reduce genetic influences, preventing atherosclerosis in older adults. So, the risk for atherosclerosis increases if a father and or a brother was diagnosed with a heart disease before 55 years of age, or if a mother or a sister was diagnosed with a heart disease before 65 years of age. But through the age and a family history of early heart disease are risk factors, is that not mean that you will develop atherosclerosis. If you have one or both, making lifestyle changes or taking medicines to treat other risk factors can often lessen the genetic influence and prevent atherosclerosis from developing even in older adults. And now, let's move on some other risk factors. In the first one was sleep apnea, or a disorder which the breathing stops or gets very shallow while a person is sleeping. So, sleep apnea can raise the chances of high blood pressure, diabetes, and even heart attack or stroke, or it may lead to develop atherosclerosis. Now let's move on stress. So, research shows that the most commonly reported trigger for a heart attack is an emotionally upsetting event, particularly one involving injury. So, stress is sometimes pervasive during negative life events and can lead to the information of plaque in the arteries or that lead to atherosclerosis. And the last one is alcohol. Heavy drinking can damage the heart muscle and worsen other risk factors for atherosclerosis. So, men should have no more than 2 drinks containing alcohol a day, while women should have no more than 1 drink containing alcohol a day. And now, for the last part of my topic, let's move on to emerging risk factors. Scientists continue to study other possible risk factors for atherosclerosis and have found that high levels of protein called C-reactive protein. So, C-reactive protein is annular pentameric protein found in the blood plasma whose circulating concentration rise in response to inflammation. So, CRP in the blood may raise the risk for atherosclerosis in a heart attack. So, high CRP levels indicate inflammation, triggering artery damage with plaque growth. Low CRP levels may slow atherosclerosis progression, with research exploring inflammation and CRP reduction. So, high levels of CRP are proof of inflammation in the body, which is the body's response to injury or infection. Damage to the arteries' inner walls appears to trigger inflammation and help plaque grow. People with low levels of CRP may get atherosclerosis at a slower rate than people with high CRP levels, and research is currently underway to establish whether reducing inflammation and lowering CRP levels also can reduce the risk of atherosclerosis.
Good day to each and everyone. I am Jamila Bago and I am assigned to discuss to you about the causes of atherosclerosis. Atherosclerosis is a slowly worsening disease that may begin as early as childhood. So, ang atherosclerosis daw is pwede siyang mag-start as early as childhood. The exact cause of atherosclerosis is still unknown. Pwede siyang mag-start or magsimula sa damage or injury sa inner layer ng isang artery. The damage may be caused by high blood pressure, high cholesterol, high triglycerides. High triglycerides is a type of fat or lipids in the blood. Smoking or chewing tobacco, diabetes, insulin resistance, and obesity. So, once na ang inner wall ng artery is na-damaged, ang blood cells and the other substances may gather or pwedeng magtipon sa injury site at mag-build up sa inner lining ng artery. Over time, fats, cholesterols, and other substances also collect on the inner walls of the heart artery, which is, ang build-up na ito ay tinatawag na plaque. Plaque can also cause the arteries to narrow or lumiit, which can cause blocking of blood flow. Pwede ring sumabog or pumutok ang plaque, which can lead to blood clot. That would be all. Thank you. Good day, everyone. My name is Yasmin Pagayawan, and my assigned topic is Epidemiology of Atherosclerosis. So, what is atherosclerosis? So, it is a thickening or hardening of the arteries. It is caused by buildup of plaque in the inner lining of the artery. So, plaque is made up of deposits of fatty substances, cholesterol, cellular waste product, calcium, and fibrin. So, as you can see in the picture is the normal blood flow of the blood in our arteries if there is no plaque. So sa baba niya makita ninyo ang kalahian if naanay kuan diferensya or abnormal blood flow sa inyong arteries. So it is called plaque. So plaque is buildup of fatty deposits. So makita ninyo diri ang example sa kanang plaque if you will use microscope. So the next slide is the epidemiology. So atherosclerosis is less prevalent in Central and South America, Africa, and Asia. The mortality in US in 5 times higher than Japan. So according to United States data for the year 2004, for about 65% of men and 47% of women, the first symptom of atherosclerotic cardiovascular disease is heart attack or sudden cardiac death. So death within 1 hour of onset of the symptoms. Then atherosclerosis can affect mostly of the arteries in the body, including arteries in the heart, in the brain, arms, legs, pelvis, and kidney. So, what are the risk factor for atherosclerosis? So, first one is kanang mga taas og cholesterol and triglyceride levels, obesity, physical inactivity kanang mga walay gibuhat dili exercise, high saturated fat diet, especially kana pong mang smoke, high blood pressure, and the last one is the type 1 diabetes kana bitong sa mga bata pa. And then, what are the complications that you can get in atherosclerosis? So the first one is the heart attack, and then the carotid artery disease, stroke, aneurysms, and headache. So, plaque often starts to build up during childhood and gets worse with age. So, ang plaque mag-start daw unyang mga bata pa ta din mas worse na siya pag makaedad na ta. So, you can see in the picture is the flow of normal artery to pinaka-complicated jud. So, habang papatanda tayo, mas mukomplikado ang ato ang health if di na to siya ma-prioritize. So, kaning pinaka-complicated na nga stage kay thrombus or thrombosis or hematoma. So, thrombosis is there is a blood clot in the artery. So, mas-stuck ang dugo diha kay mag-clot man na siya, gahi man na siya. So, muklat ang blood hantod sa hantod, then dili mo flow ang blood. So, it can lead to complication or pwede mamatay ang pasyente if di na siya ma-prioritize. And then, so you can see the chart. So, table 1 estimated 10-year risk of coronary artery disease according to various combinations of risk factor levels expressed as the probability of an event in 10 years. So, that's all for my report. Thank you for listening and God bless.
The pathophysiology of acute coronary syndrome. When we talk about acute coronary syndrome, we are also talking about the atherosclerosis or equals to fatty plaque that can cause obstruction of your blood vessels, particularly your coronary blood vessels. These atherosclerosis tissues can produce what we call stable plaques, which means they don't move. They just stay there and they don't cause much damage to the heart. In fact, there is no permanent damage to the heart. And it is called the stable angina. On the other side, the we have the unstable plaques. We these unstable plaques, what are we need to worry about? Because they eventually cause rupture of the tissues, which can create clots or the blood clots in the vessels. These clots then turn into what we called acute coronary syndrome. This acute coronary syndrome lead to two things: the transient ischemic and the sustained ischemic. The transient ischemic is an on and off heart chest pain does not cause permanent damage to the heart. This is called unstable angina, which is characterized by chest pain that is not triggered by activity. It can also be triggered during at rest. And we have the sustained ischemia, which your cardiac tissues undergo permanent damages. This is destructive to the heart because this is what produce what we call the myocardial or wounds or the myocardial infarction to the transmural tissues, which can be damaging to the heart, can have long lasting impact. Eventually, that myocardial infarction can lead to what we call the myocardial necrosis or the inflammation, which can turn or lead eventually to necrosis or myocardial necrosis. This is an inflammation which can produce a permanent damage to the heart, and this is irreversible at this point. Pag umabot na siya sa myocardial necrosis, it is irreversible at this point. Wala na siyang pag-asa. It will lead eventually to death.
Symptoms of atherosclerosis. Atherosclerosis develops gradually, typically begins in early adolescence, and is usually found in most major arteries. There are usually no atherosclerosis symptoms until an artery is so narrowed or clogged that it can't supply adequate blood to your organs and tissues. Sometimes a blood clot completely obstructs blood flow or even breaks apart and causes blood clots that can trigger a heart attack or stroke. Arteries are affected. For example, is atherosclerosis in heart arteries have symptoms similar to those of a heart attack, such as chest pain, angina. So, ang atherosclerosis in heart disease is katulad ng pag-aatake sa puso, like yung pananakit ng dibdib, paghirap ng paghinga, cold sweats, dizziness, extreme tiredness, heart palpitation, yung feeling na ang heart mo is nagre-race, then paghirap ng paghinga, at weaknesses, yan yung all symptoms of atherosclerosis in heart disease. Next is atherosclerosis in the arteries leading to the brain. Have symptoms such as sudden numbness or weaknesses in your arms or legs, difficulty speaking or slurred speech, or dropping muscle in your face. Itong atherosclerosis in the arteries leading to the brain is yan yung humahantong sa utak. So, may mga sintomas tulad ng biglaang pamamanhid o paghihina sa iyong mga braso at binte, kahirapan sa pagsasalita o malabo na pagsasalita o paglaylay ng mga kalamnan sa iyong muka. At temporary loss of vision in one eye or dropping muscles in your face. So, this is the signal of atherosclerosis in arteries leading to your brain. Next naman is atherosclerosis in the arteries in arms and legs. Produces decreased blood flow in called peripheral artery occlusive disease. Have symptoms such as leg pain and when walking. Ang sintomas naman nito is yung pananakit ng binte kapag naglalakad. Minsan nagdudulot din ito ng dysfunctions, erectile dysfunction sa mga lalaki. At pagbaba din ng blood pressure in an affected limb.
Good day everyone, I am Anarig Munaifa. So let us know the complication of atherosclerosis. So what are the complications of atherosclerosis? Atherosclerosis interferes with the normal workings of your cardiovascular system. It can limit or hinaharangan niya yung daloy ng dugo sa iba't ibang bahagi ng ating katawan, including our heart and brain. We have here a possible complications of reduced blood flow include carotid artery disease, coronary artery disease, heart attack, mesenteric ischemia, peripheral artery disease, renal artery stenosis, stroke, and transient ischemic attack or TIA. Atherosclerosis can also weaken your artery walls, leading to the formation of aneurysms. Thank you.
Hi everyone, good day. So I am Merhamin Aziz and this is my assigned topic. So it is the test and diagnosis. So doctors may find signs of narrowed, enlarged or hardened arteries during a physical exam. So these include a weak or absent pulse below the narrowed area of the artery, then the decreased blood pressure in an affected limb, then the hissing sounds or bruits over the arteries heard with a stethoscope, then the signs of a pulsating bulge, aneurysm in the abdomen or behind knee. Then the last is the evidence of poor wound healing in the area where blood flow is restricted. Depending on the results of the physical exam, doctors may suggest one or more diagnostic tests, including the blood test, Doppler ultrasound, ankle brachial index, other imaging tests, angiogram, and the last is the electrocardiogram or the ECG. Blood test. Lab tests can detect increased levels of cholesterol and blood sugar. So this cholesterol and blood sugar may increase the risk of the atherosclerosis. Then the Doppler ultrasound uses a special ultrasound device or the Doppler ultrasound to measure blood pressure at various points along arm or leg. So the measurement of Doppler ultrasound can help doctor gauge the degree of any blockages, as well as the speed of blood flow in the arteries. Next one is ankle brachial index. This test can tell if one have atherosclerosis in the arteries in your legs and feet. Doctors may compare the blood pressure in ankle with the blood pressure in the arm. So this test is known as the ankle brachial index. So an abnormal difference may indicate peripheral vascular disease, which is usually caused by atherosclerosis. Other imaging tests. Doctor may use ultrasound, a computerized tomography or CT scan, or a magnetic resonance angiogram or MRA to study the arteries. So these tests can often show hardening and narrowing of large arteries, as well as aneurysm and calcium deposits in the artery walls. Angiogram to better view blood flow through heart, brain, arms, or legs. Doctor may inject a special dye into your arteries before an x-ray. Itong test naman ay known as an angiogram. So the dye outlines narrow spots and blockages on the x-ray images. The last is the electrocardiogram or ECG. An electrocardiogram records electrical signals as they travel through your heart. So an ECG can often reveal evidence of a previous heart attack or ones that's in progress, and these signs and symptoms occur most often during exercise. That's all. Thank you.
Treatments and drugs. Lifestyle change, such as eating a healthy diet and exercising, are often the first line of defense in treating atherosclerosis, but sometimes medication or surgical procedures may be recommended as well. Various drugs can slow or sometimes even reverse the effects of atherosclerosis. Here are some common choices. Cholesterol medication, also known as statin or lipid-lowering drugs, is prescribed to manage high levels of cholesterol in the blood. This medication help lower LDL or bad cholesterol and sometimes raise HDL or good cholesterol, reducing the risk of cardiovascular disease. It is important to take them under the guidance of a healthcare professional as they may have potential side effects and interaction with other medication. Antiplatelet medication like aspirin to help prevent blood clot formation by inhibiting platelet aggregation. They are commonly prescribed to reduce the risk of heart attack and stroke. Anticoagulant are medications that prevent blood from clotting excessively, reducing the risk of blood clot. They are commonly prescribed to individuals with conditions like deep vein thrombosis or atrial fibrillation. Warfarin and heparin are examples of anticoagulant. Blood pressure medication, also known as antihypertensive medication, is prescribed to manage and control high blood pressure or hypertension. There are various classes of blood pressure medication, including beta blockers, receptor blockers, calcium channel blockers, and others. This can help slow the progression of atherosclerosis. Other medication, doctor may suggest certain medications to control specific risk factors for atherosclerosis, such as diabetes. Sometimes medication to treat symptoms of atherosclerosis, such as leg pain during exercise, are prescribed. Sometimes more aggressive treatment is needed. If you have severe symptoms or blockage that threatens muscle or skin tissue survival, you may be a candidate for one of the following surgical procedures. Angioplasty, it is a medical procedure to widen, narrow, or obstruct arteries, typically performed to treat conditions like coronary artery disease. During angioplasty, a balloon catheter is used to open the blockage, and sometimes a stent is placed to keep the artery open, and may also be done with the laser technology. Endarterectomy is a surgical procedure to remove plaque or fatty deposits from the inner lining of an artery. It is commonly performed to treat atherosclerosis, a condition where these deposits narrow the arteries and restrict blood flow. These procedures help restore proper blood flow and reduce the risk of complications such as stroke or heart attack. Thrombolytic therapy is a medical treatment aimed at dissolving blood clots. It is involved the administration of medication called thrombolytic, which can break down clot that may be causing blockage in blood vessels. This therapy is often used in conditions like heart attack, stroke, or pulmonary embolism to restore blood flow and prevent further damage. However, it is carries risk and is not suitable for everyone, so it is used depend on individual patient circumstances and the specific medical condition. Bypass surgery, also known as coronary artery bypass grafting, is a surgical procedure used to treat coronary heart disease. It involves grafting blood vessels from the parts of the body to create alternative routes for blood to flow. Bypassing blocked or narrow arteries in the heart, this helps improve blood flow and oxygen supply to the heart muscles, reducing the risk of heart attack and other complications. Lifestyle and home remedies. Lifestyle change can help prevent or slow the progression of atherosclerosis, like stop smoking, exercise most day of the week, eat healthy foods, manage stress, manage the condition of high cholesterol, high blood pressure, diabetes, or other chronic disease. Prevention. The same healthy lifestyle change recommended to treat atherosclerosis also help prevent it. You heard it before: stop smoking, eat healthy foods, exercise regularly, maintain a healthy weight, drink less alcohol. Just remember to make change one step at a time and keep in mind what lifestyle changes are manageable for you in the long run.
Hi everyone, my name is Junay Sakao. I'm going to discuss the stages of atherosclerosis. Atherosclerosis is a progressive disease characterized by the accumulation of plaque in arteries. Let's explore the different stages of atherosclerosis. Endothelial dysfunction is associated with an increased risk of cardiovascular disease such as heart attack and stroke. So, ito rin ay nag-uugnay din sa kondisyon tulad ng may mga diabetes, high blood pressure at mataas na kolesterol. Ang endothelial dysfunction ay maaring sanhi gaya ng paninigarilyo, labis na katabaan, at kakulangan ng physical na aktibidad. So, ang treatment ng endothelial dysfunction ay maaring involved sa lifestyle modification at medication at surgery. Ang stages of fatty streak, ito ay madalas nakikita sa mga kabataan. Ang mga pangunahing arterya tulad ng carotid artery at aorta ay nagpapakita ng yellow streak at this stage. The components of this streak are cholesterol, smooth muscle cells, and macrophages, which are subset of white blood cells, and ang fatty streak ng atherosclerosis ay hindi nagpapakita ng anumang mga sintomas, pero maaari itong maging isang fibrous plaque. Common treatments for this stage include cholesterol lowering, medication, blood pressure control, and lifestyle modification such as eating healthy diet and exercising regularly. Ang fibrous plaque ay binubuo ng kombinasyon ng mga fatty deposits, kolesterol at iba pang substance sa dugo at nailalarawan sa pamamagitan ng fibrous cap na sumasalakaw sa plaque. Ang fibrous cap ay binubuo ng collagen at iba pang fibers na ginawa ng katawan bilang tugon sa pagtatayo ng plaque sa arterya. So, ang common treatments at this stage include medication to control cholesterol and blood pressure, as well as procedures such as angioplasty or to open blocked arteries. Complicated lesions. In advanced atherosclerosis, the fibrous plaque can be stable or unstable, and the stability of the plaque is determined by the thickness of fibrous plaque. If the fibrous plaque rupture, it can expose by underlying lipid core, which can lead to the formation of thrombus or blood clot that can block the artery and cause a heart attack or stroke.
I am Suhaila Isuba, and this is the introduction to nursing care plan for atherosclerosis. Atherosclerosis is a progressive disorder ng arteries kung saan ang fatty deposits, kilala bilang flux clog or atheroma, are narrow the blood vessels walls. So when the arteries are narrowed, the blood cannot go through easily. So it often develops slowly over decades na nagkukos ito ng pagbaba ng blood flow, affected vessels or sa affected area, na naglilid ito ng variety of health complications sa kalusugan ng tao. So some of example of health complications is yung mga heart disease and stroke or coronary artery disease. So the nursing care plan, it revolves around comprehensive care and support for individuals with these conditions. So, ano nga ba ang purpose of nursing care plan? So, na-identify niya ang specific needs ng pasyente at nag-establish ito ng relevant goals para ma-implement ang interventions at ma-promote ang overall health and well-being ng isang tao.
My name is Zaira Tomanor, and I was assigned to discuss about how lifestyle changes and home remedies can help prevent or slow the progression of atherosclerosis. So, the first one is stop smoking. Why smoking is one of the reasons why atherosclerosis developed. It is because yung mga chemicals na nai-inhale mo when you smoke causes damage to your heart and blood vessels, which makes you more likely to develop atherosclerosis or plaque buildup in the arteries. So, kahit sabihin mo pa na paminsan-minsan lang naman or alternate lang naman, still mag-cause pa rin yan ng damage sa heart and blood vessels. So, it's better to stop na lang. Next is exercise most days of the week. Yung mga regular aerobic exercise lang na pwedeng gawin sa bahay or sa labas, for example, yung jogging and unting stretching lang naman can help fight atherosclerosis by reducing the amount of fat in your blood. And nakakatulong din ito na mapababa ang yung BP if abnormal yung rate ng BP mo. It can also decrease the amount of cholesterol in your body, and of course, daily exercise will help you and your body to control your weight. And of course, you did the exercise most of the days of the week. You stop smoking. You also have to eat healthy foods. So when you say healthy foods, these are fruits, vegetables, meats. So when you eat meats, you have to control it, like alternate lang, ganon. Because may mga benefits pa din naman na kailangan ng katawan mo na nakukuha dun sa meats and fish, ganon. Kailangan mo lang i-control yung pagkain mo nun. Next is manage stress. You have to learn how to manage your stress. Kasi like, diba, ang daming nagagawa or naidudulot ng stress. Pwede kang mawalan ng gana nitong kumain, mag-exercise, which are very unhealthy, diba? Hindi lang mentally, but maapektuhan din ito ang physical health mo, which can cause risk to your heart. Next is manage the condition of high cholesterol, high blood pressure, diabetes, or chronic disease. So as I mentioned earlier about the healthy exercise, about the eating habits, the healthy eating habits, it can help to manage your conditions of high cholesterol, blood pressure, diabetes, or chronic disease. And that's all. Thank you.
Assigned topic is assessment and diagnosis. So first, let's discuss the assessment.
assessment of atherosclerosis, we have the following characteristic of the assessment of atherosclerosis. Number one, demographic data.
Nalalagay dito yung age, gender, height, weight. Then second is presenting complaint. Then number 3 is history of presenting illness. Kasali na dito yung duration, onset, frequency of presenting complaint. Then number 4 is history of past illness. Ito yung any history of hypertension, diabetes, and infections. Then number 5 is medical history. Ito yung mga medical related to the person's symptoms, other drug like oral contraceptive and antihypertensive. Then number 6 is family history. Kasali na dito yung mga related to diabetes, hypertension. Then number 7 is personal history, yung pasyente yung mga hobby niya like cigarette, smoking, alcohol intake or physical inactivity. The number last is occupational and environmental history like yung pasyente or yung pasyente is full of stress in life. Then
Nursing assessment.
The first step of nursing care in the nursing assessment. During with the nurse will gather physical or psychosocial, emotional, and diagnostic data. In this section, we will cover subjective and objective data related to coronary artery disease. So, in-discuss muna natin yung subjective and objective niya. So, the subject first is the subjective data. They have a 3 category here. Is number 1 is ask the patient about the general symptom. Notes the patient complain and general symptoms such a chest pain, masakit yung chest niya. Number 2 is shortness of breath, dyspnea. Number 3 is rapid breathing, tachypnea. Number 4 is difficult of breathing while laying or sitting, orthopnea. Then painting, syncope. Then next is palpitation. The next is lower extremity edema. Then next is pain in the lower extremity. Then last is difficult in performing physical activities. So, second naman is a investigate the chest pain further. Ask the patient to describe the characteristic of the chest pain. So we have the following is chest tightness. Second is a feeling of squeezing. Next is heaviness. Then number 4 a burning sanction. Number 5 is pain duration physical activities. Then number 7 is triggers such as stress or substance use. Then last is pain in the radiate to the jaw, neck, left arm, or back. Then number 3 naman is assess the patient, the rest. In the following is kasali na dito yung age, damage and narrow artery is more likely to develop as people age. The next is gender. Men are at greater risk, but the risk increase for women after menopause. Then family history of ischemic heart disease. This is a high risk if the immediate male related father or brother had a heart disease before age 55, or if the female relative mother or sister had a before age 65. Then race number last is race, ethnicity. Minority groups such as Hispanic and Black have a higher incidence of CAD. So, let's move on to the objective.
data. Objective data, we have physical assessment. We have four characteristics of the objective data. We have monitoring vital sign, EKG, and telemetry monitoring. Number 3 is systemic assessment approach, and last is calculate the patient risk. So, let's discuss muna yung monitoring vital sign. Due to the increased oxygenated blood supply to the heart, vital sign, especially the pulse rate and blood pressure, are expected to increase or alter. Then a second is EKG and telemetry monitoring. Should be complete immediate when a patient reports chest pain to assess for dysrhythmia. Continuous telemetry monitoring is appropriate for a known cardiac history. So number 3 is systemic assessment approach naman is may mga category dito. We have neck. The neck is distant jugular vein. The next is CNC, acute distress, dizziness, lightheadedness, syncope, and lethargy. So let's move on to calculate the patient risk. So, ang calculate the patient ASCVD, atherosclerosis, cardiovascular disease risk score. The ideal score is low 5%. It measures a 10-year stress of CAD and a heart disease. Objective considering the following. My considering dito is we have age, gender, race, blood pressure, cholesterol, medication, diabetes, and smoking. Let's move on to nursing diagnose. So nursing assessment and evaluation of the patient should be based on the 3 main nurse diagnose: rest for impaired skin integrity, rest for imbalanced nutrition, and activity intolerance. So rest for impaired skin integrity, atherosclerosis can reduce blood flow to the skin and tissue, lead to the impaired circulation in this area. So second is the risk for imbalanced nutrition. As the disease progress, it can cause reduced absorption of essential nutrients and increased risk of malnutrients. Then last is activity intolerance. Individual with atherosclerosis may experience fatigue and weakness due to reduced circulation and the effect of other health issues related to the condition.
The outcomes of a care plan for atherosclerosis should be evaluated regularly to ensure that goals are being achieved. Tests such as cholesterol and triglyceride levels should be noted as part of this evaluations process. An effective nursing care plan for individuals with atherosclerosis should include activities that address the issue underlying the disorder and its progress. Following interventions outlined above can help improve lifestyle factors that contribute to atherosclerosis like and obesity and inadequate physical activity. The diet plan outlined in the intervention should be customized to the individual's needs. The patient should focus on increasing fiber intake and eating a balanced diet which includes the right amount of fats, carbohydrates, and protein. For the interventions for individuals with atherosclerosis should involve lifestyle changes and medication. Particularly, attention should be given to improving physical activity, nutrition, and weight loss. Weight loss, maintaining a healthy weight is essential in order to reduce the strain on the arteries and reduce the risk associated with atherosclerosis. Physical activity, increasing physical activity can help reduce circulation, and the other one will be the nutrition. The patient should follow a medically supervised diet plan aimed at control cholesterol and blood sugar levels.
So the next one is the evaluation. So before that, let us know what is the important of evaluation in a nursing process. So evaluation is important in healthcare because it supports an evidence-based approach to practice delivery. It is used it is used to assist in judging how well something is working. It can inform decisions about the effectiveness of a service and what changes could be considered to improve service delivery. Evaluation is the outcomes of a care plan for atherosclerosis should be evaluated regularly to ensure that goals are being achieved. Tests such as cholesterol and triglyceride levels should be noted as part of this evaluation process. So, ang mga test daw tulad ng cholesterol and triglyceride levels is kinakailangan na manoted natin during the evaluation process. And now, let us move on to the conclusion. So, atherosclerosis is an incredibly serious condition that can have a long-term consequences if not properly managed with lifestyle changes, medication, and thorough nursing care plan. So, with proper medical care and the correct lifestyle modifications, patients with this condition can continue to enjoy activities and have an improved prognosis. So, ang atherosclerosis daw is isa siyang serious condition na pwedeng mag-lead to a long-term consequences kapag hindi daw na-manage ng mabuti through or sa pamamagitan ng lifestyle changes, pagbabago sa ating pag-uugali o mga kinagawian, yung proper medication at ang thorough nursing care plan. So, with the proper medical care and correct lifestyle modification, ang patient daw na may ganitong condition is pwede siyang mag-continue to enjoy activities and have an improved prognosis. And now, for the last, let us know what is the goal of a nursing care plan for atherosclerosis. So, the goals of care for a patient with atherosclerosis are to control the progress of the disease, minimize symptoms, enhance overall mobility and the quality of life, and prevent complication. So, ang goal daw ng care for a patient na may atherosclerosis is para makontrol natin yung progress or yung paglaki ng disease, ma-minimize natin yung mga symptoms nito, at saka ma-enhance yung overall mobility and quality of life ng isang tao, and lastly, para ma-prevent natin yung mga complications dulot ng pagkakaroon ng atherosclerosis. And that's all. Thank you.